Hi, Josh here from pharmacisttips.com. Just going to talk a little bit about the medication famotidine, the 20 milligram tablets, talk about some of the side effects that are associated with that medication. My website's pharmacisttips.com. I appreciate it if you stop by. What is famotidine? Well, it's what's called a histamine 2 blocker or an H2 blocker. What that is it blocks the production of stomach acid that's used then to prevent and treat ulcers of the stomach and the intestines, also bleeding. Also used to treat reflux. Over the counter, it's indicated for heartburn, acid indigestion, and sour stomach, and you'd find it under the brand name Pepsin. Dosage varies. Over the counter, it's the 10 milligram dose once or twice a day. Be sure to talk to your healthcare provider if you want to use it long term, just to make sure there's no issues. You're not having a bleeding ulcer or some other serious condition that you're just kind of masking with it. Prescription dosage for ulcer usually starts at 40 milligrams at bedtime for 1 or 2 months. Then you go down to the 20 milligram dose to kind of maintain after that. Reflux, again, dosing can vary on severity of it, but kind of a medium dose would probably be the 20 milligrams twice a day. Of course, that'll be up to your healthcare provider to help you decide on the correct dose. Side effects, as a whole, pretty well tolerated. Your standard side effects: dizziness, drowsiness, headache, diarrhea, constipation. There are some rare serious side effects with famotidine, specifically suppressing the bone marrow. So you'd want to watch if you start bleeding easier than normal, that sort of thing. Your doctor will probably monitor labs like CBCs just to make sure that's not happening. Again, rare, but it's often monitored for, especially on the higher end of dosing. What about famotidine and alcohol? No, it's best not, especially if you already have stomach issues. The alcohol can irritate the lining of the stomach. It can worsen ulcers. And so typically 1 or 2 drinks, probably not an issue, but it's best to discuss it with your doctor first, as we don't want your condition to worsen. Thanks for watching. I hope you found this information useful, but be sure you always talk to your healthcare provider before you stop, change your medications. I'd appreciate it if you subscribe to my channel, if you appreciate my videos and like them. Always watch for side effects. Talk to your doctor or pharmacist if you think you're having side effects with your medications. And I'd appreciate it if you stop by my website, pharmacisttips.com. Thank you.